In this episode of the Hormone Replacement Therapy for Women podcast with Angie Nichols, we talk about Managing Menopause 2019, the what, the when, and the how.
Please like and subscribe. Thank you.
And hit that notification bell so you won't miss anything. Hello Angie, how are you?
I'm well. How are you, Stephen?
I'm fine, thanks. So, since we have a lot of questions for you to cover about the menopause, let's dive right into it.
Okay.
First
Sure.
one, what is menopause?
Menopause is the period of time in a woman's life when she stops menstruating, and this marks the end of the reproductive phase. So it's the permanent end of fertility. And it's a major hormonal change for women, as you can imagine, because we lose all of the hormones. And when we lose our hormones, it affects our physical and psychological well-being. Although menopausal symptoms vary from woman to woman, some women will go through it very easily, but some people have a lot of distress with it. It occurs because of inadequate ovarian function. It is generally due to the aging process, but it can also be due to surgical intervention. And some other things that could cause it would be chemo, radiation. You could have a complete hysterectomy or an oophorectomy. So but generally, it's 1 year with no period is the definition of true menopause.
Okay, and at what age does the menopause begin?
Generally, it's between 45 and 55. In the United States, the average age for a woman going through menopause is 51. So a lot of things can factor into that. Smoking will put a woman through menopause earlier. The other things that I mentioned, such as a surgical intervention, chemo, radiation, and also genetics. Women can ask their mothers, what age did you experience this? And that will give you a good clue as to what to expect. But it's different for every woman.
Okay, and what physical changes do women experience at the menopause?
It varies from woman to woman. I've heard some women say they didn't experience any symptoms at all, but most women aren't that lucky. And so most women will start to experience, the first clue is usually hot flashes. Also, they'll notice more difficulty losing weight, especially around the midsection. Sleep problems, either insomnia due to hot flashes or various reasons. There's a redistribution in body weight. So normally, premenopausal women carry their weight in their hips, thighs, and buttocks. But when you lose estrogen, fat begins to accumulate around the midsection. And so you'll notice a redistribution in body weight. There is a loss of muscle mass, vaginal dryness, chills, metabolism slows, more difficult to lose weight. There can be gum loss, tooth loss, a loss of breast fullness, osteoporosis, elevated blood pressure. I think I mentioned insulin resistance already. It can be joint pain, bloating, digestive problems, irritability, lack of sex drive.
That's quite a list, yeah, quite a list.
Absolutely.
And what are the psychological changes women experience?
Okay. Irritability, depression, anxiety. It could be mood swings back and forth between all of those. A lot of women don't understand what's going on. They just know that something's not right. They don't feel the way that they did before. And can also have some problems with memory, the mental fogginess that the women report, difficulty concentrating, making decisions.
Okay, quite a list as well. And so what is the most important hormone for women to have after menopause?
Estradiol is, I think, the most important hormone that we need and the most important one to replace after menopause because of the positive effects that it has on the cardiovascular system. 90% of women will die, 90% of women will succumb to heart disease. So estradiol plays a major role in the prevention of heart disease. It also protects against Alzheimer's and dementia. So it prevents osteoporosis. 40% of women will die within 2 years of an osteoporotic fracture, and the osteoporosis is directly related to the loss of estradiol. So major things, just the day-to-day feel-good effects of, being able to lose weight, also hot flashes, vaginal dryness, that's big. It reduces visceral body fat, so it can decrease our risk of type 2 diabetes. So estrogen is very important. As you know, a lot of even the health benefits that men get from testosterone is due to its aromatization into estradiol.
I understand. Yeah. And what is the best method of delivery of estradiol for women after menopause?
Well, oral estradiol provides the maximum cardiovascular benefits because of the first pass effect through the liver. So that's always our choice is to provide it orally. You can get it other ways. You can get it in a cream form, but you miss out on the cardiovascular protection. It doesn't lower your LDL like it does when you get it orally. So we prefer oral estradiol when we can.
And are there any side effects of giving estradiol to postmenopausal women?
Side effects are, if you think about PMS symptoms, that's what you will see when you have estradiol levels without enough progesterone to oppose it. So you have to have a balance of both. Because again, progesterone enhances everything that's great about estrogen, but it negates the negative. So if you don't have enough opposition with progesterone, you'll get breast tenderness, bloating, irritability. If a woman has a uterus and you don't give enough progesterone, she can experience spotting and bleeding. So estradiol builds up the uterine lining, and if that becomes too thick, then they'll experience spotting and bleeding. If you don't treat that, then it can lead to endometrial cancer. So you have to be very careful in women that still have a uterus.
Okay, so women need oral estradiol after menopause, and the dosing, is that a general dose, one kind of pill that is on the market for every woman? Because I have no idea, is it a bit the same like with testosterone for men, that you really have to take on the dose for each man individually?
The cost effectiveness of oral, it's more cost effective if you order it commercially, not compounded. So they do make a 1 milligram and a 2 milligram oral estradiol tablet. And we start women low and slow on all hormones because we don't know how they're going to respond. Some women are much more sensitive and some women just aren't. And so they need more. So we usually start with a 1 milligram estradiol tablet, and then we monitor levels and move up.
Okay, I understand. And do all women need progesterone when taking estradiol?
Yes, all women need progesterone. We need it at any reproductive phase. It was once believed that only women needed progesterone if they had a uterus because of its positive effects on the endometrial lining. But we now know that progesterone gives us many more positive benefits. It is a calming, mood stabilizing hormone. And as I mentioned earlier, a lot of the anxiety and depression, mood swings that women experience at menopause can be very effectively treated using progesterone. So we need it for that, but it also has a positive effect on blood vessels and on bone health.
And what is the best delivery method of that one, of progesterone, and the side effects maybe?
Okay, progesterone, the best way to raise your levels is sublingual. It can be a sublingual troche that you place under your tongue. It dissolves very well. It could be a rapid dissolve tablet taken sublingual. That raises your levels very, very well. It's not the most pleasant tasting hormone, so sometimes women complain about the bitterness of it. But it is the best way, raises levels very nicely. Oral progesterone is also a possibility, but there are a few drawbacks to that. We do use oral sometimes, but when you take progesterone orally, you are only absorbing about 40%. So you have to generally use more. So sometimes if a woman is having a lot of trouble sleeping, because also oral progesterone will cause drowsiness. So if she's having sleep problems, that's a good choice for her maybe, but usually it's not enough to get it in a good range. So we end up doing oral at bedtime to help improve sleep, and then also maybe a rapid dissolve tablet or a sublingual troche in the day just to get those levels in a good range. But the troches, when you take it sublingual, it doesn't pass through your liver, so you don't get the drowsiness that you get with oral progesterone. Another
Okay.
thing that you have to consider when you're looking at progesterone for women, if she's also taking oral estradiol and you give her oral progesterone, it's going to lower the estradiol level. So you just have to kind of figure that out and take that into consideration.
Okay, I thought there was a kind of combination pill that combined the two that made it easy.
You
But
can combine them together, but when you do it orally, again, it's going to lower that estradiol if you combine them together, and then it makes it more difficult to adjust one or the other because they're all combined in one. So that's why we prefer to do ours separately. You can also get it in a cream form, but cream is not well absorbed, and I have yet to see a woman come to us on a cream that was anywhere near a therapeutic range.
okay, I didn't knew that. And the side effects of adding progesterone to the estradiol after menopause?
Really, you can't get enough progesterone. We need it. I suppose if you gave way too much progesterone, she could become too calm and maybe too sedate and maybe have a flat affect. I've yet to see that. A lot of women tolerate really high doses of progesterone very well.
And what kind of doses are you talking about?
We generally start with a 200 milligram sublingual troche, and then we kind of go from there. But with progesterone, a lot of it is really just like testosterone. It's based on symptoms.
Okay. So what about the third one, maybe testosterone? Do postmenopausal women need that too?
Absolutely. We need it just as much as you do, but we only need about 10% as much as you do. It helps give us all the positive benefits just like you. It helps us be able to build lean muscle, helps us break down fat, it lowers insulin resistance, it's a mood enhancer, it lowers our cholesterol levels, helps with decision making, it improves collagen production, so it improves your skin tone and texture. And it's also been approved by the FDA to treat breast cancer. A lot of people may not be aware of that. It improves your ability to build muscle.
And testosterone declines as well with menopause.
Absolutely. When a woman goes through menopause, it's really just complete endocrine failure as far as the sex hormones go. So testosterone, estradiol, progesterone, the levels often are just too low to even measure. So Keith will sometimes say, it would be the same as if a male were castrated. And you can imagine how a man would feel if he lost all of his testosterone.
Yeah, sure thing. And what is the best method of delivery for testosterone in women?
We utilize testosterone cream in women. It's very well absorbed. It raises blood levels very nicely. It's easy to apply. We only apply it once a day. We apply it perivaginally before we go to bed. So by applying it perivaginally, it removes any risk of transference, to children or someone that should not have it. It's not going to affect a male if he comes in contact with it because our dose is so minuscule compared to what a man can tolerate. It wouldn't have no effect on him.
Why is that only once a day?
We just don't need as much as you do. So we can get by with just once a day. We have to, again, low and slow with women because we want to avoid the negative side effects that testosterone can cause for us.
What are these?
They can be acne, that's most common, and hirsutism or hair growth, facial or body hair growth. So we have to be careful, and that's just changing the dosages. Women don't want to grow a beard, and we don't want acne. So we have a few things that we can utilize if that becomes a problem, but we start low and slow so that we can avoid it from happening in the first place.
And what kind of doses are in those creams?
The range is all over the place. So we can start with like a 10 to 20 milligram per gram concentration, and then we kind of move up from there. So it's the same thing. We measure every 4 weeks until we figure out the dose that relieves their symptoms without giving them side effects and where they are where they feel comfortable.
Okay, so that was very interesting. So a lot of women ask, when can I stop taking the birth control pill then? Because I imagine the hormones are a bit of the same that are in those pills. So when they're taking them, they say, I don't know if I'm menopausal or not, and I don't want to get pregnant, but would prefer not to take them if I don't have to. So when can they stop, and how do they know?
Right. A lot of times women will come to the clinic and they don't know. And so they will fall into a menopausal age category, but they're still on birth control pills just because they never stopped them.
Mhm.
So we have to, in those cases, when there's any question about menopausal status, we will have them stop the birth control pills for about 2 months. And we, of course, always caution them to use another form of contraception during that time because they still can conceive. And then we'll retest their FSH and LH in 2 months, and that will tell us about their ovarian function. Of course, we also have to factor in symptoms, and that's a good way. And then a lot of times women are able to come off of those birth control pills because they've been menopausal and just didn't know.
Mm-hmm. And there's no point in feeling better on those birth control pills to keep the menopausal symptoms away. No.
No. And because most birth control pills, they're going to be a synthetic hormone. And so we want to avoid those at all costs because we know that the synthetic hormones have been linked to cancer and lots of problems. And so we want to avoid those for sure.
Okay, I think we'll talk about that in later episodes for sure. Okay, so are there any other ways to treat symptoms of menopause besides hormone optimization therapy?
There are some things that you can do. However, the symptoms that come with menopause are due to a loss of estrogen and loss of all of your other hormones. So really, in order to return to a better state of health, it's going to be to replace them, to treat the cause. So we look at replacing all of the hormones. Not everybody agrees with this. This is a controversial thing, as you know. ACOG and NAMS do not support the use of hormone therapy except for the shortest period of time and the least amount. And that's their official statement of what they believe. And that's all based on their belief that all hormones are created equal. They believe that Premarin is identical to estradiol. I think an estrogen is an estrogen. And one of the slides that I provided you shows the difference in the chemical structure of estradiol. Estradiol is 100% estradiol, and Premarin is about 10 or 12% estradiol, and then it contains a whole bunch of horse estrogens, and it comes from pregnant mare urine. So whenever you have that, then you're going to have some negative effects because it's foreign to the human body. So when we start metabolizing it, we do start having some negative effects. There were some studies that showed, the differences. Premarin actually increases the risk of DVT or blood clot, whereas estradiol does not, because the potency of a horse estrogen is much stronger. So also Premarin and estradiol both raise the good cholesterol. So that's good. Both Premarin and estrogen do raise that. But Premarin also raises triglycerides, whereas estradiol does not. Premarin raises C-reactive protein or inflammation. Estradiol does not. So there are a lot of differences. Both Premarin and estradiol will decrease visceral body fat, and both of them can relieve menopausal symptoms. So we prefer the oral estradiol that's identical to what our body produces on its own. There are some women that have come to us that were taking things like red clover, and that was able to relieve menopausal symptoms like hot flashes, but it wasn't enough to get them in the range to where they had the cardiovascular protection. So
Yeah.
there's a really good study I put on here. It didn't exactly copy the whole thing well, but it was a study that was done about the protective effects of estradiol against Alzheimer's disease. And the study that I showed you, actually, there are 2 other studies that showed the very same thing. And it showed that a woman that takes estradiol for more than 10 years has a 5-fold risk reduction in the rate of Alzheimer's. So some really good benefits as far as cognition and its effect on the brain. And then there's a really good 2018 review of articles that was published in the New England Journal of Medicine. And it talks about how estradiol postmenopause reduces the risk of cardiovascular disease and all-cause mortality. And the reduction in cardiovascular disease was between, I believe, 35 and 50%. So there's a lot of literature out there that supports why we do what we do, but unfortunately, it's just not common knowledge among mainstream medicine.
Yeah, I imagine. It's like in the male hormone optimization therapy, of course.
Absolutely.
Okay, so it seems to me that this would be a very difficult time for women. So how can men help as a woman go through these changes?
Sure. As our bodies begin to change and losing weight becomes more difficult, it can have a negative effect on a woman's self-esteem. It can lessen her self-image. Some women will mourn the loss of being able to bear a child. And but then again, some other women, welcome the freedom that brings and not having to worry about a period anymore. So, with all these changes and that come, it can be really hard. So, things that men can do is just offer support, offer reassurance, try to be understanding, and learn a little bit about what she's going through. Because as I mentioned, you can imagine how devastating it would be to a man's health and also his psychological well-being if he suddenly went from producing adequate testosterone to zero. We see men come in and their levels can be low, but they're not going to be too low to measure unless he's taking something or he's got some kind of really bad disease process going on. So it would be, they would become depressed, they wouldn't be able to function sexually, muscle mass would be lost, and that can have a detrimental effect on psychological well-being. So I think just understanding and support can go a long ways.
Yeah, sure. So how long should you take hormone optimization therapy? Because you just mentioned the American Academy of Gynecology recommends the least amount for the shortest duration, but of course women want protection for life, no?
Right, absolutely. As long as you want the benefit, you have to continue to take it. It's just like a blood pressure pill. If you stop the blood pressure medicine, your blood pressure is going to go up.
Okay, it's like TRT, of course. It's a long life duration. Yeah, it's just, yeah. Okay, so last question. How can women find a doctor that can help manage the menopausal symptoms? Because as you said, it's not mainstream yet, so that will be a difficult task, no?
It is very difficult to find doctors that are knowledgeable about it. Doctors aren't trained in hormone optimization in medical school. And so if you want the education, you have to go and get it on your own. And you spend a lot of time and a lot of money devoted to learning about hormone optimization. So I would just recommend doing your research, finding out what type of education they have. The offices should be able to give you information and be willing to talk to you ahead of time. There is a directory at WorldLink Medical that you can go to and look for doctors that have trained. I think the doctors on the directory have to have at least completed 4 courses, and the difficulty increases as they go on in order to be on that directory. So that would be a good starting point. Always, it's good to ask friends and family that for references if they have been treated by a doctor for that. Forums like this are great ways to learn and find doctors that may be able to help you. A lot of times we've had patients, volunteer. Hey, if anybody wants me to talk to them on this, I'll be happy to share my experience. You have to be careful about HIPAA violations, and but those are ways, just referrals and doing your research.
Are there any clinics in Europe you know of that can provide this kind of information?
No, unfortunately, I don't know of any of those.
No European clinics on that list yet. Okay, so
there will be.
Yeah, we'll try to get the word around. So that's what we're doing here. So thank you so much for all this information, Angie. Anything more you want to add for the viewers?
I think not. I appreciate the opportunity to talk with you about this topic, and I hope that women will find benefit in it. And
I think sure this will help a lot of doctors and women, of course. So how can people reach out to you if they want to work with you?
they can find us at tier1hw.com.
Okay, thank you so much, and talk to you in the next episode.
All right. Thank you so much.
Okay, thanks.